Hello, everyone. Today we're going to be talking about Tiffany's transformative occupational therapy and navigating nursing challenges. And this is presented by Gilberto, Matt, Zen, Julia, and myself, Louis. Now, when it comes to this case study, Tiffany is 30 years old. She works as a travel nurse in Chicago, rotating her hospitals every 2 to 3 months, struggling to adapt and missing home. She faces a dilemma with her sister's worsening cerebral palsy and kind of requires her to kind of consider breaking her contract to return to Texas and work locally. Concerned about her financial penalties and future employment prospects, she grapples with balancing familial obligations and career stability.
Support and benefits. The way occupational therapy can assist Tiffany is by providing coping strategies for stress management and emotional regulation, offer guidance in exploring alternative career options and negotiating contract terms, facilitate adaptation to new work environments and patient populations, and finally assist in maintaining work-life balance and addressing familial caregiving responsibilities.
Tiffany may experience adjustments of physical demands and routines, like repetitive movements of gripping, which can lead to carpal tunnel syndrome, pushing and pulling heavy objects that are 30 plus pounds, patient transfers and lifts by herself without proper form, leading to higher risk of developing musculoskeletal disorders, and swelling at the feet due to the lack of muscle contraction to help with blood flow because of standing for long periods of time. Her assignments typically last 2 to 3 months at a time, so she's adjusting constantly and dealing with irregular work hours affecting her circadian rhythm, and her pineal gland is unable to secrete melatonin at the appropriate hours, contributing to low quality sleep, and the high stress she is experiencing will cause her cortisol levels to spike, so she's more susceptible to contracting an illness.
When it comes to the physiological challenges for Tiffany, coping with uncertainty and anxiety about career transitions and family responsibilities. And number two would be dealing with guilt or conflicted emotions about leaving current job and colleagues. As for number three, would be managing feelings of isolation and inadequacy or overwhelmed in new environments.
Some social cultural challenges that Tiffany may be facing. Societal expectations and norms. As she is the older daughter in her family, she has a duty to care and support them. And since she's also considering breaking her contract, that can also reflect in her employment record, which would be difficult in obtaining a job for future references. It may also affect her reputation and decrease performance, increase financial instability. She may receive penalties from that current agency that she's in, and she is less likely to be considered for employment in the future. She may be having difficulty acclimating in her new environment that she's currently in. She may be experiencing homesickness and culture shock.
Role of the OT, how occupational therapy can address Tiffany's needs. The OT can provide holistic assessment and intervention to promote Tiffany's overall well-being and occupational engagement. The OT can offer client-centered support to empower Tiffany in making informed decisions and achieving occupational balance. The OT can collaborate with Tiffany to develop coping strategies, enhance resilience, and navigate socio-cultural challenges. The OT can advocate for Tiffany's rights and needs within healthcare and employment systems to ensure equitable access and support. The OT can also provide suggestions like becoming a family caregiver for her sister who has cerebral palsy. Thank you for listening. And here is all our references. Thank you for listening.